Hi, just trying to connect with Ashley from Bands, blood flow restriction bands. You've probably heard about them or seen them, but you're not quite sure. So I'm just joining her, I'm hoping, right now. She's in California, no, she's in San Francisco. Now, so she's in San Francisco, and hi Ashley, are you there? She's in San Francisco. I'm in Christchurch in Dorset. Hi.
Hey,
It's been a long time coming.
I know, right?
Yeah, yeah, yeah.
Oh, this is so
But
cool. We're like on other sides of the world doing this technology,
I,
right?
I know, I know. I think it's just so amazing. And I
Yeah.
think how I came across you, I think you saw a comment that I wrote on someone's post. And then I did a post about lactate being the thing that you need to produce and
Yep.
why that's why we're being told to lift heavier, go
Hmm.
faster, because it's all about the lactate if you want to make those physiological neurological changes in your body. Um,
Yep.
so I was going to say,
Correct.
Ashley, do you want to ta tell, I'm going to say my viewers, a little bit about yourself? You've got a pretty impressive resume. You've been named on
Sure.
the
Yeah.
top 100 trainers in Men's Health magazine,
Yeah. Yeah.
top
Thank you.
10 in
Well,
San Francisco Bay.
look at you doing your homework on
I
me. I like
did.
it. Yeah. Yeah. I mean, I've been in fitness. I was an athlete in college. I was a Division 1 champion athlete. And then I went on to coaching. My first paying client
Yeah,
ever was Jackie Joyner Kersey. So kind of started out with a
brilliant.
bang. And
Yeah.
from
And
there,
you were invited to train them,
correct.
weren't you?
Yeah.
Yeah.
Yeah, which was amazing. I was in my 20s and it was like opportunity of a lifetime and kind of kicked off my career as a coach, kind of
Yeah.
realizing I had a knack for it and I enjoyed it and I yeah, it just came naturally. I think all the years of being an athlete, I was very in tune with movement and my body and I
Yeah.
understood it really well and I had a way of being able to I think one of my skills is I have a way of articulating complex movement and kind of simplifying cues and I don't know. I found my way into coaching, but and then I found my way into fitness, and I opened my own fitness studio about 20 years ago now. So I've been
Oh,
in
wow.
mostly working just with clients looking to improve health. So I have a few kind of
Yeah.
elite athletes I've trained, but most of my career has been with in health and fitness. And now as I'm getting older, I'm 55. I had a hip replacement in my 40s after
Mhm.
a long struggle with a hip injury that in my 40s. I went through menopause at 43, so young. I had a hip
Oh,
replacement the
yeah.
same year. I lost a bunch of muscle. I had frozen shoulder, torn plantar fascia, the
Yeah.
whole thing in my 40s. It was just like, and this is kind of before everyone was talking about menopause
Yeah.
and the
What's
connection.
going on? Yeah.
Yeah, so I had a tough 40s physically, and it really took a pretty big hit mentally for me because I was sort of like, if I'm feeling like this now and
How?
I'm trying to do everything I can possibly do right. This has been my passion my whole life. What am I, what's it going to be like in 20, 30 years? And really having that feeling of I don't have as much control over my health as I thought I did because
Yeah.
you know,
When
and
you have
then
an
that's,
injury, yeah.
yeah, yeah. And then that's what led me to finding blood flow restriction was I was just really like, frustrated and looking for options and my dad had had a shoulder replacement in his 70s and his doctor and his physical therapist used it with him. It's very well
Wow. So
known and respected in that.
yeah. So you saw it in
Exactly.
action. And is that
Saw it in
how,
action.
so is that what led you to go and investigate it and work out
Yeah,
how
so
this could be the thing?
I started using it just a little bit on my upper body,
Yeah.
not fully. I'll admit, I didn't really fully dive into the research. I just thought, oh, this is a way to build muscle under
Yes.
light load. Like that's what I understood. So I was
Yes.
like, oh, I'll do that. But then I started using it I got curious enough about, I want to learn more. And so I went to a
Yeah.
conference, and in that conference, that is when like the light bulb went on, the paradigm shift in my head of like, this changes everything. If this
Yeah.
is increasing lactate, if this is increasing human growth hormone, if this is enhancing strength in every cell of our body and improving bone density, why aren't more people doing this? And I went on a deep dive to learn everything I could about it. As soon as I started using it more seriously on myself, I had life-changing improvement in my hip and my strength and
Wow.
how I felt, and which then impacted me mentally. Like now I do feel like I have a little more agency and
But
control
yeah,
over this because it's something I can do. It's not hard, it's accessible. Blood flow restriction training sounds so intimidating. It's a horrible name.
it
People
does.
immediately, I know. And I've even thought about calling it something else, but all the research is under blood flow
It's
restriction. So
all,
then it's I think at the end of the day, you just have to educate people on what it really means, and what it is doing is just slowing down our venous blood flow, which causes hypoxia in the working muscle. And that hypoxia causes a bunch of really healthy things to happen in your body, like
yeah,
increasing lactate, like causing your type 2 muscle fibers to get involved when they normally wouldn't, which are super important for aging, like
yes.
improving bone density. So yes, it's slowing down our blood flow, but it causes a very healthy response from our body.
Yeah, I
So
mean,
yeah,
obviously, producing in order to produce lactate, we've got to be working above that lactate threshold, which basically means working in the anaerobic zone, and that's why we have to work so damn hard to get to that level.
exactly.
So when I came across it, I saw what you were about. I had only seen, I think Peter Attia talk about them, and saying that he would use them at the end of a workout session to build his biceps, build his triceps, or something like
Yeah.
that. That was the only thing that you saw, but it was like, what are those about? And I saw one person once in the gym using them. Um, and then I think I said to you, I saw a picture of Dr. Von der Wright using them, but didn't really say anything about it.
Hmm.
And I'm thinking,
Hmm.
is it because all the science that's coming out or has been there is saying that with these blood flow restriction bands, you don't have to lift as heavy, work as hard to produce the results to change your lifestyle.
It's
What's
true.
your
It
take on
it
that? I'm
is true.
just
And
throwing that in
yeah, I mean,
because
it's
it
a really
changes
good question.
everything.
I am still so shocked and surprised that it's not out there more broadly
Yeah.
because it is powerful. I've now worked with hundreds, 300 to 400 people now that have gone through my program,
Uh-huh.
and anyone that is does the program, we did a 6 month study. I have
Yes.
people
Very impressive.
contacting me that people that are doing it, and it's mostly we're work. My passion is work with midlife and
Yeah.
older women, because
Yes.
as our hormones change, that's when we start having the pain point of like, I'm losing my muscle, I'm losing my bone, I'm gaining fat that I don't want. Like
Mm.
those pain points kick in, right? And what we used to do to stay fit is generally not working as well because our body's not hormonally responding from exercise the same way it used to. And blood flow restriction bands, because of the lactate increase,
Hmm. Is then producing
causes
all.
causes that bigger hormonal
Yeah.
response that we need. And people are getting, like, I just had a woman email me and said, I have been on a weight loss journey for 2 years. I've lost 60 pounds in that 2 years, but my body fat percentage has stayed the exact same, meaning she's
She
losing
lost muscle.
as much muscle as fat.
Mm.
She's done BFR for 1 month, and she lost 3% body fat, lost 6 pounds of fat, gained 6 pounds of muscle in
Yeah,
1 month.
that's fantastic.
And she wasn't a couch potato before this. She teaches yoga.
Yeah.
So it's interesting that women who are already active but are not able to get the response from their
Yes.
body that
So
they're wanting, this is such a great solution. Yeah.
so it's really interesting because I put up a post about two PhD doctors, two very famous ones who argue they have different points of view. And the thing being was that all the studies were what was coming out from one of them, which is what I truly do believe because I see it in myself now. If you have been previously very active, as you get older, you really don't produce the same responses as somebody else
Mm.
does. It's almost as if you've got to work even harder. I know my belly fat is just coming along, coming to get me, and I've got to work. I've got to work so much harder, do those extreme sit sessions after my weight session to keep everything,
Hmm.
in check. But it gets tiring. You don't want to do it
Yeah.
all the time. And I've got to
Well,
lift heavier and everything else. But
yeah. And
there's a definite thing about being older. If you have been active, it's a lot harder to make the changes than somebody who's been inactive.
Yeah,
And it's
because
just
what
what
you've always done in
stuff.
your life that's
Yeah.
caused that metabolic response, that anaerobic response,
Yes.
it's not as effective anymore. And you've
Yes.
already been working hard. You can't
Yeah.
work harder, right? So like someone who hasn't been active, they haven't been working hard. If they work
Yes.
moderately hard, they're going
I'm gonna get all my lights on. Oh, the sound has just come off.
to
Oh,
interrupted. If you're
yeah.
continuing to work hard, but your hormones go down, you get less result from that same hard work.
Yes.
And you can't really then all of a sudden go harder because you're already
You,
working
you're
hard. So
already
that's
at that
why,
hard level. Absolutely,
right.
absolutely. Um,
And
do you know what I'd
yeah,
love?
go ahead.
What I was going to say, what I'd love, because I've been reading the studies and I've been watching some of your videos on YouTube as well, which are fantastic. And one of the things is about, I'd love to ask you about osteoporosis. So we know that we can work at a lesser, we don't have to work so extreme with the bands to produce the effects of producing muscle, losing weight, turning white fat into brown fat, making our mitochondria work more efficient, reducing insulin. But what
Hmm.
about bone? Because what people are also very much interested now is like, do we have to work as hard to produce new bone? And I know there's a
Hmm. Hmm.
fascinating study on there that about someone who broke a leg and they put the bands on that leg and didn't have it on the other leg and they got results. Something like
Right.
that.
Right. Yeah. And actually, I was just looking up. So it's a great question. So there's a couple different ways that our body produces bone. One is off sheer stress, or like the reason jumping is so effective is because there's a quick pull on the bone from our
Yes,
muscle contracting. So that quick
yes.
pull stimulates the bone. But the other big way we build bone is it's by hormones and things circulating in our blood, like
Hmm.
there's osteoblasts that form bone, and the more those circulate in our blood, that helps lay down bone and
Hmm.
increase bone mineral density. There's also bone oh, what's the word called, resorption markers, means they're
Hmm.
breaking down bone, and we want to reduce those. So we want to reduce the amount of bone that's being resorbed, meaning broken down, and we want to
Yes.
increase the amount of bone
Please.
that's being right.
Nice.
And so there's been studies done on bone density that shows very, very clearly that if you compare low load training, this is what I mean. If you compare low load training, so someone that does light exercise with weights, but lighter weight, compared to the same low load exercise with BFR, it is hands down, BFR is way better at creating bone density and those healthy
Just doing low bump
cells. And yeah, it increases you actually build
and
more
increases,
capillaries when you're doing BFR, so you get
yes,
better
blood
oxygenation and blood flow
supply.
to the
Yeah.
bone, which is important. It increases human growth hormone, IGF-1, which both help with
Hmm.
bone turnover,
Does it
increasing bone
increase
mineral density,
testosterone as well?
and increases
Testosterone.
testosterone as well.
Yeah.
Yes, it does. And so all those things help with bone. And the interesting thing, I was just looking at this, that a couple years ago they did a study, a meta-analysis of like all the studies
Yeah.
out there on bone density, on BFR for bone density, and this was in 23. They did a
Right.
meta-analysis, and they said clearly shows that low load training with BFR outperforms low load training by itself for bone,
Yeah,
hands down.
rather than doing
But
25 reps, 30 of low reps, going on
right,
forever, put
but
the
then
bands
it
on.
said right, but then it said high load training was a little bit better than low load with BFR.
Yeah,
But interestingly, all their subjects were mostly young men. So now there was a new meta-analysis
done. Yeah.
done just April 2025, so super new, that was with older adults and older women. And they
Right.
showed that high load and low load BFR had very much the same results for bone. So
Oh,
there was
that's
no extra
fantastic,
benefit
isn't
from high
it?
load. Yes. And I think that's because, I mean, I'm hypothesizing, but I think it's partially because as we get older, we just can't work as hard, so we're not getting as big of that benefit from heavy.
You think you're
And for
lifting heavy and also maybe are not
Right.
lifting as heavy as you
Right.
should be. But yes, you're not
And we're
getting,
not able to get that metabolic hormonal response that we used
yeah,
to get. So as you're older, the BFR has been shown to give you a bigger lactic response and metabolic
boss,
response.
which is
So
what
that's
we
kind of
want.
almost overcompensating for the heavier load. So the lighter load, you're getting this over metabolic compensation, which is real. So
Yeah.
I was really happy to see that now they're even saying for um, older populations, and by older, I think that's like midlife up. It doesn't
I
mean
don't.
elderly because, you
Yeah.
know,
Okay. So the terminology is really wrong and outdated for midlife and old life because we think of ourselves. We're similar. I'm just 1 year older than you, and we think of ourselves as midlife, or actually we're quite young midlife.
yeah, yeah,
Whereas 20 years ago, midlife was 40, and there wasn't much going on there. And
right.
you think, and people in their 70s now, I would say midlife was maybe 40 to mid to late 60s, depending on how well you've kept your body, as
Mm-hmm.
in how much
Mm-hmm.
exercise you've done, how healthy you are. Whereas, and then I would say, okay, older population were sort of in their early mid 70s. However, nobody keeps, we're a small percentage of the world that actually exercises, um,
Mm-hmm.
if you like. So I think the elderly population could be 55, 56.
Depending, right? Yeah, it's so, yeah, I agree. And as we get older, there's such a exercise even plays a bigger, the divide starts to get
Yeah.
even bigger. Yeah.
But yeah, it'd be really fascinating, won't it, to see what comes out in the next few years. I mean, thing is, because women's health is never in the spotlight, it was obviously all done on men or on younger women. The studies aren't there, so we can only do what the science we know tells us to do. But
Mm-hmm.
obviously,
Mm-hmm.
in years to come, we're going to be told, no, you do it this way, you do it that way.
Mm-hmm. Mm-hmm.
So things are
Yeah.
changing. You've got so many people arguing about different points of view, but
Mm-hmm. Yeah.
it's
So
evolving,
true.
isn't it? Um,
Yeah. Yeah.
so the osteoporosis thing, I'm really looking out for to see what happens with that.
Yeah, I'll send you, maybe I'll link later in this, if we
I think it
post
would be
this,
good.
the link to the study that I'm talking about. That was a meta-analysis that just got published a few months ago that was looking at an older population and bone
Yes,
health in particular. And it showed that low load BFR was as effective as high load training
that's really
with a
good.
lot less stress on your body, a lot
Yes.
lower risk of injury, less recovery time needed so you can be more consistent. Workouts are
Mm.
shorter. There's so many reasons that blood flow restriction training is simpler, easier, so you become more consistent, which is the
Which
name
is
of the
what you
game,
need to do,
really.
because
Right,
quite
right.
often you've done a really, really heavy session and you've overdone it. You are out for the next few days.
Yeah,
You're like, I
exactly.
have no energy. And I really feel that now. Really, really, really
Mm-hmm.
feel
Mm-hmm.
that.
Yep.
And I feel good at the time, but I'm like, okay, that's me done.
And then what's
So,
that doing to cortisol and what's that, like
yeah, the whole
I
thing.
know it's
So,
yeah.
what I want to know is, okay, one question I'll ask you before, have you got some bands? Is that people want to know about, can you use the bands if you've got high blood pressure, and are they dangerous, and how they came about? Um,
Mm,
you know,
yeah,
you,
that's such a common question, right? Are they
because
safe,
that's
right?
what
That's
people think. They think, oh my gosh, I've got high blood pressure. What's it going to do? Are they too tight?
yeah, yeah.
Was it like that?
So
Is it different now?
yeah, and that's a great question, and that's the thing that pops into everyone's head immediately is like, is this safe? That's what I mean. The name is terrible because it makes it initially sound like it could be unsafe. First of all, it's been around for 60 years. It's really well documented in medicine
Mm.
and physical therapy as very safe. And it's even gotten safer over the years because they've made the actual physical bands, which I'll grab in a second, safer. When they were first figuring out 50 years ago, they were playing with different bands. They didn't really know what they were doing. If you
Yeah.
stop arterial flow, that is not safe. But every reputable band company out there now has some built-in mechanism that makes it where you never stop arterial flow. And so there's
Yes.
no safety precaution. Even if you have high blood pressure, it's safe. Now, most people with high blood pressure are being treated for high first. And I
Yes.
would start just like with any fitness. If someone comes to me and they're deconditioned or they have risk factors with their health, I'm not going to crush them in their first
No.
workout.
Yeah.
I'm going to start them gradually. Same thing with BFR. That means I wouldn't go super tight with the bands. I wouldn't leave them on for a full 20 minutes. I'd start with 2 or 3 minutes. Have them
Yeah.
get the burn, have them feel that, have their vascular system respond. One of the things your vascular system does when there's that pressure and there's like hypoxia, your body releases a gas called nitric oxide, a really amazing chemical that causes vasodilation, which
Dilation,
means
yeah.
so it relaxes or expands your vascular system, which is amazing because our vascular system gets stiff as we age. And so to have this kind of
But
expansion of your
yeah.
vascular system is very healthy and will actually over time decrease someone's
Keeps the
blood
blood
pressure.
pressure.
So it's very good for someone with high blood pressure. You just want to be sort of reasonable as you get started.
Yeah.
Um, but
I
there's
think
no
I
real risk.
yeah, so it's
Yeah.
like with any yeah, with that you take the precautions and it's like if
Yeah, you just
you
start
do
gradual and meet them
and
where
you
they're
make
at
sure
the
you're
level
allowed
they're
to
at.
yeah. So yeah,
Exactly.
I'm gonna say show us the bands.
Yeah, give me one sec. They're right around the
Okay.
corner. I forgot to grab
So
them. All right.
I say look at your lovely gym, Ashley.
Yeah, that's my gym in the
I
background.
know.
My
Wow.
playground.
If
So
I ever
these
come
are
to
the
San
bands.
Francisco,
You have to. You have to.
love
I'll
to.
show you around. We'll do a workout. We'll hang out.
I know.
Um, So these are the bands that I use. They're called B3 Sciences.
Yes.
There are multiple. There's Katsu, there's Suji, there's Saga. There's lots of different bands. What I like about these is they're low tech, which I
Yes, you
appreciate
mentioned them.
versus some of
Yeah.
them that are, you need your app on your phone, you need it to be charged. If there's a disconnect, like just
Yeah.
too much. So again, not bad or good, just personal preference. I
Yeah.
like kind of lower tech. You just put them on your arm. So this is the armband. There's arms and leg bands.
Yeah,
I'll
and
just
listen,
show
can
you
you
really quick.
actually can you sit? Yeah, that's great. Yeah,
So I just put it on my arm and I strap it over my arm and it just
yeah,
kind of tight, but I can still fit. It's not like doesn't hurt or anything.
yeah,
It's just a
yeah,
little
yeah, yeah,
snug. And then I take the pump. So there's a little pump here, like a bicycle pump kind of, and you just
yeah,
stick it on
yeah.
the band, and once you have it clicked in, then you pump it up and you know how much you're pumping it to. So I could say like, oh, I want to pump it to 200. Okay, there I'm at 200, and that feels good. I feel a little bit increased tension. I just unsnap the thing and now I can go do
You
whatever
go
I
and do
want
the
with the bands.
exercises.
You
That's
can swim, you can do cardio, I do a
nice.
lot of strength training with them,
You
but you can
don't
do
think
just
about
about
swimming
anything.
with them. Wow. So all
Even
those,
walking
yeah,
with them are great. By the way, you'll like this. Walking with BFR
yeah,
helps bone density way more than walking without BFR.
yeah, yeah,
So
yeah.
yeah.
Better than weighted jackets, eh?
Those are popular and now sort of controversial, but
Oh
so one
wow. So
one thing about these bands I want to
yeah,
show you. Can you see how there's like little bubbles kind of
pockets. Yeah,
pockets? This
yeah.
is what makes these bands totally safe because it actually is never a tourniquet. So even if you pump them super,
Right.
super
So
tight,
you
you
can't.
will always get blood. You cannot
Yes.
cut off your blood. So that
Yeah.
makes these safe. The cardiologist that invented these wanted them to be 100% safe, even for
Yes.
seniors, 90-year-olds, like anyone. And so
That's
he made this
fantastic.
design that he's a cardiologist. So he's an
Mm.
expert on,
I
the
really.
vascular system.
So is it, are they being used more and more in the States now? Because I've never, I have really never ever come across any physios in the UK talking about them,
Mm.
or this is how we're going to get you healing, or yeah, I've never heard people telling me, oh, I've used those with my physio or whatever. I
Hmm.
just don't think they.
That's a good question. I
No,
think
yeah, use
around
them.
here, at least in the Bay Area, I hear about them from physical people. Oh yeah, I did that at my physical therapist, or I
Yeah,
heard about it from a physical therapist. Less common in fitness yet, but I'm
yeah,
trying to
let's bring
change
that
that.
up.
I'm
Yeah,
trying to really bring the education around. Um, I think how a lot of people view BFR and the way it had initially been presented was that it's really like you have a knee injury, so use it on your quad for this one little exercise to make your quad not
rather
atrophy.
Yeah.
Not like it's good for your whole body. It produces hormones. It increases metabolism. It uses up glucose in your like. There's all these great things it does. It's systemic, but people have been approaching it in this really narrow lens. Like you even mentioned Peter Attia doing just like maybe arms at the end of his workout
Yeah,
to get
yeah. At
muscle
the end
size.
of the session, this is what
Great,
I'm
but
going to
that's
do.
still like
Yeah,
only
it's not
using
saying
like
what, yeah,
10% of its real
of
ability.
what
And
it can
what
do.
yeah, what we did in our study, so we did a 6 month study of midlife women that followed our program, which was
Mhm.
just 3 times a week of about 20-minute workouts, and that's what they followed. And we did it as their primary fitness tool, not as a secondary
Extra.
finisher or a
Yeah.
PT exercise, but like their primary fitness tool. 3 strength workouts a week with the BFR bands on,
Yeah.
and everything we measured we got statistical significance in. That means body fat loss,
Mhm.
strength gain, muscle mass gain, decrease in pain significantly, increase in motivation and adherence because people were finding it simple and they felt good, they didn't hurt, and decrease in resting heart rate, which shows
Doing
vascular health,
good.
cardiovascular health. So, and that's all they did differently was doing 3 times 20 minutes. And they were already people who were exercising before and they got improvements on all those areas. So I'm trying to show people that, and it's not like I'm the only one doing this, but I think I'm the only one that's doing it all virtually and trying to
Yeah.
get more people involved, is that it can be for women in particular, and especially if you're a woman who does not like to lift heavy, can't lift heavy. I had a hip replacement. I could not lift heavy without feeling like
Oh,
my body was paying for it. I still was lifting kind of heavy, but I wasn't lifting really heavy, right? So for
yes.
some reason you can't, don't want to, are too tired to, don't have the equipment to, if there's a reason you can't lift heavy, BFR should be your
Please.
primary fitness
And it's
tool
and
to get
it's
those results.
and particularly now, if you are in midlife and you haven't exercised very well, and now you're getting all the menopause joint pain,
Hmm.
the frozen shoulder, my knee hurts, my hip, I'm getting this done, I'm getting that done. Definitely,
Hmm.
definitely. I was saying, I think said to you earlier, I want to get my sister into using them because she's had a lot of I think
Yeah.
she's had a lot of issues with menopause and pain,
Yeah.
rotator cuff injuries, and
Well,
now
and
knee,
and you're
whatever.
right. Like
And I think,
people
and
go
it's
into
like she can
menopause.
try as hard as she can, but then if something hurts, you end up stopping, don't you? And I feel
Yeah.
this is a
Yeah.
really, really good solution.
And there's so much of the suggestions out there and what people are talking about, all the experts and all the fitness experts are saying women need to lift heavy, women need to lift heavy. And in a perfect world, if you like lifting
It's
heavy and you feel
yes, you've
great,
done
sure.
it, but
But it's misleading so many women who, like you said, during menopause we're more set up for tendon injuries, and now you're telling someone who's probably
it's never lifted.
undertrained to go lift heavy on tendons and our like I hear so many stories of women getting injured even though they're trying to do the right thing, and it's so frustrating because it's
It's
like I'm
hard,
told I do.
yeah,
Yeah.
yeah,
So
no.
that's why I'm like, more people need to know about this because there is another option that's scientifically proven to give the strength,
Health.
bone, hormone benefits equal to, if not greater than heavy lifting.
Wow, yeah. So it's a good solution, a really, really good solution. You've got some offer with your bands, haven't you?
Yeah, I'm actually doing right now I'm doing a 30-day free trial of my program
Mhm.
where I send people the bands for free. I mean, they put down a credit card for security, but
Mhm.
because I want people to try it. By the end of 30 days, if you stick to our intro program, which is actually very simple and
Mhm.
short workouts, you will know if it's for you or not. But pretty much everyone that's done the program has done it. But even within the first month of simple workouts, have lost increased strength, increased energy, started to lose some body fat.
Mhm.
So you'll know in 30 days. Is it for you? Is it not for you? If you're someone who loves heavy lifting and that's what you, then that's probably not
But you know,
who, it's someone
yeah,
that has a
I
pain
think I
point
think you
around
can.
it, you know?
You can use both, can't you? I mean, I actually
For
enjoy
sure,
lifting.
for sure.
I
You
actually
can use both.
yeah. I mean, I can say I enjoy lifting heavy, but at the same time, when you're tired and you run down and it's just not working for you,
Yeah.
you use it
So
together, don't you?
that's a good point. I'm not trying to say that something's wrong with heavy lifting. I'm
Mm.
just saying if the wrong person is doing heavy lifting, it might not
Yes.
be the right approach.
But I think you
I
should say.
personally, I personally do one heavy lifting day a week now.
Yeah,
I used to do multiple, and my body was always achy. I always felt like I had to work around something. Now, because I've been doing BFR, I am
you're
stronger and more
stronger.
durable. So when
Yeah,
I do my heavy workouts, not only am I lifting more weight, actually, so my heavy workouts are more effective, I
yeah,
don't feel beat up afterwards. I
yeah,
feel prepared. I keep my workouts shorter. I just focus on a few primary
yeah.
heavy lifts that I feel like is best for bone density, posture, full body strength, and I go really heavy for short reps and I'm done and I feel great afterwards, which was not the case before I was doing
You can
BFR.
do it. It's really helped as well. Well, that's fascinating. That's really good.
So to
Um,
your point, it's a really good combination
yeah,
for people that
I think it is. I think the combination is there. And, I'm thinking that I want to try them out as well. Um, because purely I want to try them out to see whether it makes any difference to fat loss for me.
hmm
That's what
hmm
I'm thinking.
Yeah.
So it's a
Yeah.
good thing. Good thing. I
Yeah, let's
think
get you
is
on
there
them.
any? I think is there anything else we wanted more to mention? Um, I
And
think we've got it all.
that was a pretty good, we had a pretty good
I think we
overview.
covered it well.
I could talk for days about it, but I think we did a pretty good overview.
Yeah, and it was good seeing the demonstration. Um, and then I'm going to say, if you send me some links to your program and the bands, then I can then put them at
Yeah.
the bottom of
Yeah,
the line
I
before I
also
put it on.
I can sell the bands if people just want the bands, and with the bands we give you the free, intro program to
Mhm.
teach you how to use
Where,
them.
where, where
So
do you ship to?
that's a good question. I mean, mostly you're right, mostly US, because if we
Yeah,
start shipping
I
outside of US
know.
it gets
I
so cost
know.
prohibitive, right?
Yeah.
But people can buy the bands
Said to
on
me, there was something that you showed me on Amazon. There was a version
yeah,
of something that you thought
yeah.
was quite good.
Yeah, I'll share
You
that. We can
mentioned.
share that link
Yeah.
afterwards. And then, yeah, so people can buy the bands, and then if they want coaching, all my coaching is virtual, so they could do that from anywhere. But if they just want bands, they can. If they're in the U.S., they can buy from me, and I'll send them my 30 days for free. Or if they're somewhere else, I'll give you the link so that I think Amazon sells what are called B Strong, which are essentially the
Mm,
sister band to this, or the same exact
be
patent
strong.
and the same band. They're just a different brand. So Be
Okay.
Strong.
Okay. I'll write that as well. So I want to do it. Okay. Thank you. So yeah,
Thank you.
I
That was
think
fun.
yeah. It was. I can say it was a long time coming, wasn't it?
It was. I know. We had to coordinate time
Month.
zones and plan ahead. And yeah, exactly.
Yeah.
Well,
It's
thanks.
behind you. We're watching a nice exercise session. I saw a
You see
lady
that? You
hopping.
see that?
I
Yeah. Got
saw a
some.
lady hopping before doing a doing a
There you go. Bone
plyo.
density. Speaking about bone density, right?
Yeah, it's fun. So, okay, thank you so much.
All right. Thank you,
So,
Farah.
so I'm going to ask you to send me some links. So before I put the live out, I can
I'll,
then
s-
put the
I'll,
tag,
s-
everything else on it as well.
perfect. Great idea. I will
So it's
send you
really,
those
really nice.
today.
Really, really good talking to you.
Yeah, you too. Thanks,
Have a
Farah.
good rest of the
Okay.
day.
Bye,
Okay, bye
everyone. You
bye.
too. Bye.